Hi, welcome to everyone. My name is Todd Streelman, and I'm the chair of the School of Biological Sciences. And I want to welcome you today to the fourth Town Hall, sponsored by the School of Biological Sciences and the College of Sciences, this time titled COVID Cases Rise, Holiday Travel, and Stopping the Spread. Our speakers today are Patton Distinguished Professors in the School of Biological Sciences, Joshua Weitz and Greg Gibson, as well as JulieAnne Williamson, Executive Director of Sustainability and Building Operations, as well as Team Lead for Campus Surveillance Testing Operations at Georgia Tech. As is typical, we'll have presentations and then question and answer. Some of these questions have been submitted prior. And today we have a special guest, Brielle Lonsberry, Student Body President for Georgia Tech Undergraduate Student Government, who will moderate the Town Hall. Finally, thanks to Jasmine Martin, Assistant to the Chair in Biological Sciences, and Jess Hunt-Ralston, Director of Communications in the College of Sciences, for help behind the scenes, executing, and disseminating these town halls. Let's get started. Josh?
Thank you, Todd. Let me go ahead and hopefully share the screen, and you'll let me know if you can see it.
You're good.
Great. So again, welcome everyone. Thank you for joining us this afternoon. And today, as in prior town halls, I'll be joined by Greg and JulieAnne, trying to provide more information as we get to the close of this fall term. And in doing so, I'll start first, hand it over to Greg, and then to JulieAnne, just with some context, which is, as most of you I'm sure know, there have been an increase in cases, particularly in the Midwest and Plains, but in many other places throughout the United States, in which even medium to small gatherings, here this is a risk assessment site that we've developed with Cleo Andrews here at Georgia Tech, giving some sense that even in small groups, there can be an elevated risk that one or more individuals may be infected, and perhaps asymptomatically. And what has been particularly true and acute in the Midwest and Plains is beginning also to be evident in Georgia. So if we look at cases in the broader context here in Georgia, whether we look at cases at the state level or within Fulton County, what you can see is that there has been, over the past month and a half, an increase from a relatively speaking low level in early October to now at levels that we saw in late summer on the decline of our summer surge, but here it continues to increase. We are a campus embedded in the city, and obviously this means that what's happening in the greater community is also affecting us and vice versa, right? That spread within the community impacts all of us who interact both in Midtown and in the greater Fulton County and in Georgia. On campus, as you know, there has been the deployment, implementation, and scale up of a large-scale viral intervention surveillance program. We have had over 100,000, over 110,000 surveillance tests with increases around 2,000 a day. And what you can see is that after a peak around the Labor Day surge on campus, we've seen sustained testing levels, and actually the trends over 7 days have increased over time. And this has been supplemented by testing, rapid testing at stamps, individual kits, contact tracing, and support. All of this part of a coordinated response to reduce ongoing transmission risks. As we've emphasized before, using testing as a means to identify and stop chains of transmission potentially before they start, therefore reducing risk for all. This gives you a sense of the outcomes, particularly from the asymptomatic surveillance data. We entered and began the fall here in mid-August with levels about 0.5%, meaning less than 1 in 100, something like 1 in 200 of the random tests that we did at the population surveillance were positive. And then there was an increase rapidly to a high level here, approaching almost 5% in late August. Thankfully, with the inclusion of this viral testing program, what we saw is rapid identification of cases. Many of those cases were clustered. We were able to isolate individuals, in other cases using contact tracing, quarantine individuals, and we saw a rapid and frankly surprisingly rapid decline, so that by September 10th, we began a nearly 2-month period in which we had sustained levels of less than 1% positivity. Yes, there were identification of individual cases, but we didn't see large outbreaks, and we saw this sustained all the way through November. However, as we noted to the community, there was a warning sign. We had begun to see some increases that mirrored some of the increases going on in Fulton County in Georgia, with this particular one-time increase above 2%, where we identified a number of incipient clusters. Although the rates have gone down a bit, this still raised a warning to the community that COVID-19 was continuing to spread, and if we were not cautious, there could be yet another increase on campus at a particularly bad time, which is right before Thanksgiving. Again, thankfully, we have this viral surveillance testing program in place, and we're able to identify this quickly. As context, I think it's important to be able to compare these in as much of an apples-to-apples sense as is possible. What we've been able to do is to try to give some sense of what we believe in population incidence level estimate. If you were able to go out to the community and do this large scale of PCR-based testing, high sensitivity testing in the community based on identified cases and underreporting, we estimate to be somewhere around there, about 0.75%, less than 1 out of 1 in 100 cases. 1 in 100 individuals might test positive, again indicating that this really was a sentinel indicator of problematic spread. So what we're going to do today is talk about this context, but also the particular ways in which testing continues to identify cases on campus, what this means for the rest of the fall, to some extent, how we can wrap up strongly in a way that protects the community. Again, to reiterate, in the face of national level increases, just to point out about 1 million in the past week of documented new cases, signs of increased cases in Georgia, the surveillance program continues to operate at a high level, 10,000 or more per week of tests, identifying cases, in some sense, clustered cases, and we believe we have the capacity to respond rapidly, as we've shown we've been able to earlier in the fall and again just in the past week or so. So in the next slides, we're going to talk, and this will be Greg first and then JulieAnne, about ways in which case increases can be interpreted, and also ways in which we have modified testing plans, particularly to try to protect the community as we wrap up for the end of term. And with that, I'll hand it over to Greg.
Thank you very much, Joshua, and Todd, and everybody else involved in setting up today's talk, and for you all for joining us. I just want to start out by reiterating that this is really a major team effort with more than 30, probably more than 50 individuals involved. Mike Shannon there has set up this lab that's doing this awesome job of 2,000 a day. They're getting it to the point where we can double that. And so testing is not a rate limiting step. It's being tested that we need to work on. Helped by Mike Farrell, Anton Brixson, and Dalia Julik, the 2 core directors who've done the robotics and the ordering, all those sorts of things. JulieAnne's team with Alex Ortiz on the logistics of sampling, and Emily and Brian being critical people for clear direction and IT. And many, many people listed at the bottom there, among others involved. All with the support of Frank Neville and the Office of the President and Andres Garcia and the Institute for Biotechnology and Biosciences, and Choki Abdallah, the EVPR. So really a massive team effort. Next, thanks. So I hope most people on this call are aware of the My Test site that you go to get your tests. And if you go there, you can actually click and see this data and much, much more data. So this is a tremendous effort from the IT team, Renee Kipkowski and others in communications. And what we're seeing here on this particular page, which is the face page, is a 7-day moving average in gold against the actual number of positives identified through the surveillance program each day. And just mirroring what Joshua was showing for the country as a whole, we've seen that uptick at Georgia Tech. So the weeks of November 3rd and now to November the 13th, last Friday, we've seen things sort of double over where they were at the end of October, which itself was more than double what they were throughout most of September. So that's a concern, but it's very granular is the point we want to make. So we've done something like 110,000 tests. We've detected just under 1,000 positives through surveillance, just over 1,000 all combined. And that corresponds to a positivity per week or an incidence of around about 0.8% across the semester, which, given that we started out with such a big jump, is quite amazing. In November, we're right at that level so far. So in the first 2 weeks, we've done about 19,000 tests with 174 positives. So this has not gone away at all. And I think that in part reflects what's going on in Midtown. In part reflects probably some overconfidence in the campus community as masks dropped and social distancing decreased. If you look at it cumulatively across the semester, we know that something like a quarter of the entire Greek resident population, so people living in the Greek houses, have been tested positive. That compares with about 7% across campus of people living in the residences. And we think it's a little harder to estimate, but if you take the number of people who've actually engaged in the program, that about half of those people are off campus, and their positivity is in the range of 6% cumulatively across the semester. So we aimed to keep it between 5 and 10%. That was our best case scenario, and we've managed to do that at the low end. And that's testament both to the program, but also to the fact that the vast majority of people have really been taking this seriously. As shown in the next slide, which is some evidence that we have two cultures on campus. So the upper bar diagram or histogram is showing the number of tests taken by each person in the program across the semester. So it's bimodal. So there are a number of people, about 3,000 who've only tested once, and another 1,500 who've tested twice. And then you go down, and then you get the second peak there around about 10, where about half of campus is testing between, say, 8 and 12 times. I think the record is 133 tests. Not sure who that is, but there are some people testing twice a week. But the mode there, or the median, I'm sorry, is about one test a week. And then you've got this large section who are only testing occasionally. If you then look at the number of people, the numbers for the people who are testing positive, you can see that it's well skewed towards the left. So there are some who haven't tested at all. And then there's this big peak around 1 or 2 tests. So they've tested once or twice in the semester. And there are a few who've tested quite a lot. So testing doesn't protect you, obviously. But I think our interpretation of this is that there are two different behaviors. So there's a group on campus who are very, very comfortable with the process and are probably taking all sorts of other social behaviors that are limiting their exposure, whereas those who are less likely to test are probably also more likely to be those who are partying and engaging in other behaviors, putting them at risk. And that's a pretty clear indication of that. So how does this look when we actually look at the level of individual residence pools? So I'll just show you the data for Greek houses. And the alternative title for this slide I had was actually Greek history repeats itself. So what I want you to look at is each one of these curves is the cumulative positivity for each of these 40 or so Greek houses in each month, okay? So if you say well, you can't see my pointer, but any one of those curves, they tend to go up between July and August. And then they plateau off, so they're fairly level at that rate. So that's indicative of the fact that we managed to get things under control by this interventional surveillance program. And then we hit October and jump up to November for about half of these places where we've actually now seen an increase again. Another way to look at that is on the right, which is just sort of a heat map generated in Excel for simplicity, where you see that the darkness of the red color there is proportional to the level of overall cumulative incidence in each of those houses. And so what you see is at the bottom is that there are about 12 or 15 houses which have had no or very, very few cases across the entire semester, and they continue to be that way into November. And then at the top, you see the houses which have tested at a much higher rate, and some up to as much as 60 or 70% across the semester. And most of that happened in August. It went down in September. And you can see that there's been some repeat of that in November. So the ones that were testing positive back then are also globally the ones that are testing positive now, but with some exceptions. In fact, there's a little bit of evidence that some of those ones with very high rates may be are testing at a lower rate now, which may be indicative of some sort of immunity there, or possibly more likely it's just a difference in behavior. We don't know that, which explanation there. But overall, the trend is that if you were in a Greek house that was getting high positives back in August, that's repeated itself, played out again in November. The same is true to some extent of residences. Next slide. So this is, actually, before I get to that, this is now asking what are the differences between, on the left side there is the figure I just showed you, except now not ordered by incidence, but alphabetically. And that's in the actual Greek houses. In the middle, Greek members living in the residences on campus. And to the right, the members of Greek houses who are actually living off campus. And what you see across the three figures is a very, very great correspondence in the positivity for a house, independent of whether they're living in the house, living in residences, or living off campus. So there's something about social networks, possibly, so people coming in to dine at those houses maybe and taking it with them, or maybe indicative of behavior patterns that are in common, that are inculcated by membership of particular Greek houses. So the ones that have been negative in the Greek houses tend to be negative in the residences and off campus. The ones that are positive in the Greek houses, towards the bottom there, also tend to be positive if you live off campus or in residences. The next one is showing a similar sort of phenomenon with residence halls. So on East Campus, of course, has had a much, much higher rate throughout the semester. So this is now just in green shading. So we have a maximum of 29% positivity cumulatively for Glenn. I'm sorry, they're actual numbers. These are not rates. These are numbers of individuals testing positive in this case. And that's also spiked up a little bit in November, but there are some differences. It's a little bit less predictable dynamics. So Howell, for example, has been more hard hit, and North Avenue has been more hard hit this time around, whereas some of the others that were high before, such as Smith and Matheson, have been pretty low this time. So there's granularity there. West Campus was actually relatively protected back in August, but they've been equally hit. In fact, they were higher in October. This was quite concerning to us. But we think that the program has really been successful once again because the numbers in November are really quite low on West Campus. So the message there is stick with the program. The interventions work, going in and making sure that people who are potential carriers are taken out to isolate fairly quickly. I think I have one more slide, which is some interpretations that I take away from all of this. First of all, there's a lot of variation in test-taking cultures. We have these sort of two different types of community, probably reflecting how cautious people are, and that we think correlates with how likely they are to be tested. Once again, being tested doesn't protect you, but it's indicative of a sort of behavior patterns. Across all students, positivity is averaged around about 1% per week. And cumulatively, that means that we're less than 10%, in fact, closer to 5 to 7%, which I think is remarkably good achievement. It's hard to estimate what it would be without our culture. We think that the maximum would be what you see in the Greek houses, 50%, if there had been no mask wearing and no social distancing whatsoever. Clearly, if you look at UGA and other places, they've been able to get things down to 1.5%, 2% across the semester. So there's certainly a lot to be said for just having masks and social distancing, but we're pretty confident that the interventions are what are bringing us down to that level of about 0.2% throughout most of September. This November surge has been much more distributed across campus. It didn't start with the residents, with the Greek houses. In fact, it may have gone back to them from the residences, a backflow. But there's been no clear focus, so it's disseminated, which is also suggesting that it's coming in maybe from off campus or just from random contacts. So the bottom line is that the parties are still spreading it. Small gatherings of students who have sort of become confident in working without masks in small groups with their friends, maybe over dinner and so forth, is probably leading to some spreading, just a low level, but it's enough to put these seeds in each of the halls. So we're guarding against complacency. So where we were in September was fabulous, but clearly not enough to prevent us from this second surge, particularly as we live in Midtown, close to a rate that Joshua is estimating is also at about 0.7, 0.8%. So jackets still need to protect jackets, but we think the program is working a second time round. namely that detecting cases is helping to reduce new transmissions. And that will continue in the spring. We're going to carry this on into the spring. And the goal for us is to use that to protect research space, to maybe have a little bit more classroom activity, whether in buildings or maybe in outdoor tents and things, but just trying to get back to a more normal campus life using this combination of masks, social distancing, and interventional surveillance. And speaking of that, then, we'd like to give you some messages about where we're going with the actual surveillance for the rest of this semester and into the spring. And so I'll turn it over to JulieAnne.
Thanks so much, Greg and Joshua and everybody for having me. I appreciate the chance to share some good news and some updates on testing and answer any questions folks have. So first off, thank you to everyone who is on campus who is testing. We are seeing increasing participation. I really respect that about the Georgia Tech community. We are seeing increased rates of positivity, and with that, we're seeing 1,700 to 2,200 people testing per day through our asymptomatic surveillance program. You can see a diagram on the right. The campus map does carry our testing locations that are generally open, and you can get updates at the website linked on this slide, which will be available later. It's our health.gatech coronavirus website. We have opened in the last 6 weeks 2 research-specific test sites that continue to see steady traffic, and those are located within the BioQuad and Love MRDC areas. And we've added this month travel certification testing, so we'll share a little bit more about that, but that's for any students traveling and then for employees on business-related travel. And it's the type of testing that is saliva-based as well, but we'll give you the certification documents needed to be able to board an airline or enter a destination. So if we go to the next slide, thank you, Joshua. A little information about the immediate future, Thanksgiving week. So we want to recognize many students are going home prior to Thanksgiving, and we want to accommodate the need for additional testing for those good behaviors that are being recommended and the exit testing guidance being shared through communications and Stamps Health. We will have special weekend hours. These are centered in our residence hall locations. The housing community and the Greek community in particular have easier access. These are the Glen Towers connector, GT connector, right across from the Athletic Association on Bobby Dodd and Techwood. It's the Couch building on West Campus. Right next to the dining facility, West Village Dining Hall, And then finally, the North Avenue Apartments. So those testing sites are going to be open Saturday and Sunday afternoon, the 21st and the 22nd. You'll see more communications about that. We also want to be sure that anybody in Midtown has an option. Our off-campus apartment dwellers, our employees around 760 Spring Street. We will be opening this test site I'm coming from today from 9 to 5 on Monday, the 23rd, and 9 to noon on Tuesday, the 24th, just to catch the last folks who might be exiting prior to the break. Surveillance testing will close Tuesday at noon for the week. We will reopen the following week, but we just want to be sure if you want to test before Thanksgiving, you have options over the weekend on both days, and then Monday all day and Tuesday morning prior to Thanksgiving. That'll allow the lab to process those tests and get results back to folks as they travel. So travel certification testing, just a quick update. This utilizes saliva-based vault test kits. Those are kits that Georgia Tech had purchased. They are saliva-based, use a little more saliva. They are available at 2 key locations, 10 to 3 at Price Gilbert Library at that site any weekday, and 760 Spring Street, which is open Wednesdays through Fridays on typical weeks. So when those sites are open, between 10 a.m. and 3 p.m., you can come in, take a vault test kit that is administered by staff on site, and then we ship that to Vault, and there's a 48-hour turnaround. Once it's received at the lab, you receive an email with very specific results, your positive or negative diagnostic test, and it's a test that's out there in the marketplace. So it's easily identifiable by anybody you have to show certification to. And again, there's more information online about travel certification testing through the health.gatech page that's referenced here. So we can go on to the next slide. Thank you. And finally, winter break. We will continue testing. Surveillance testing will stay open with the exception of Christmas week. We plan to run normal operations through commencement. Should you be attending commencement, you'll have that option the Thursday or Friday prior to do a surveillance test. We will still be open at a somewhat reduced level in terms of the number of sites. The week of December 14th, again, we do close Christmas week when the campus is closed. We will resume testing with reduced operations the week of December 28th, and there will be closure on the New Year's holiday. Again, more information will be very specifically laid out as we get closer. January 4th, that week, is again reduced operations. We go back to full operations January 11th in preparation for spring reentry testing. And when we talk about reduced operations, in addition to our 2 research sites at IBB and Love, the library, Price Gilbert Library, and the 760 Spring Street sites will be open and staffed those weeks. And that will be for both the campus surveillance testing and for travel testing should it be needed. So that's the testing update. I'll toss it back to Joshua now.
Thank you so much, JulieAnne. Just to give a few summary points here, and I think we've tried to reserve ample time for questions today in this town hall. There was an email that went out via Institute Communications, and I want to reiterate now that we are essentially a week and a half prior to Thanksgiving, that JulieAnne just noted that there's this additional availability of testing, which I would hope means that individuals on campus, particularly students, but also for staff and faculty, should take advantage of this and add an additional test cycle in, which means that you could try to get in a second test, in other words, 2 tests, one this week and another one prior to Thanksgiving. This enables key information, testing now, reinforcing mask wearing, and continuing to wear masks whenever inside, even when hanging out with that friend group that you're sure, well, you only hang out with them. I'll just point out that PAWS and friend groups, even if with our best of intentions, this is a transmissible respiratory disease, spending some time indoors, extended time, certainly increased risks of transmission. We're going to reinforce that, taking opportunities to take a lunch or dinner outside, socializing outdoors, wearing masks when you're inside. All of those are going to help an effort that when you get that negative test, you can remain in that negative status and take another test a few days before you travel, right? Ideally 48 hours before. The purpose there is critically, as many public health officials have said, statewide, nationwide, don't bring COVID-19 home for the holidays. Testing, this intervention surveillance testing at scale, helps keep you, colleagues, staff, friends, and families safer. And we want to reiterate this point to remain vigilant as we wrap up fall. Yes, we've identified increase in cases, but that identification has, in fact, helped us scale up and adjust our testing, identifying a number of small outbreaks and trying to reinforce testing and, if necessary, isolation and quarantine to make sure that those don't become another resurgence of cases. And so far, that has been the case. Teaching, as you know, we only have a few more days left of this predominantly hybrid mode. A reevaluation of teaching modes will obviously depend on case dynamics, and we will continue to use this testing, intervention, surveillance testing into the spring. To reiterate this point about essential interactions and risk, we understand that this is a particular time to say goodbye to friends, colleagues you might not see for a little bit as some of you go home, obviously for not just for Thanksgiving, but for the end of the term. During this period, we want to reiterate avoiding large gatherings and try to essentially substitute indoor gatherings for outdoor gatherings. Right? And so you can avoid even those outdoor gatherings, the chance of transmission risk by spacing out, wearing a mask, socializing outdoors. And all of this helps to protect not only you and your friend group and their families, but also workers here on campus, those people who work whether in facilities, staff, faculty you may be interacting with, and dining service workers in other contexts. So the key takeaway here is that in the identification of this increase in cases, there's been an uptick in cases, but we've also increased our testing. Through the response of the community, we believe that we can continue to keep levels low and make sure that not only you, but your families are kept safer over the break. And with that, I just want to again thank JulieAnne and her team and all of the folks who are working on the operations logistics side to make this possible. Greg, who obviously, as you know, was critical to the even initiation of the saliva-based testing, and everyone in the community who has taken their time and committed week after week to this saliva-based intervention surveillance testing and help to keep themselves and the community safer. For more information, times, dashboard, and so on, mytest.gatech.edu. And at this point, I'll stop sharing the slides, and we're more than happy to try and field questions.
Okay, a number of questions have come in the Q&A, and then we have a number of questions that were submitted ahead of time. Brielle, would you like to moderate the questions and ask the panel, please?
I would love to. And thank you for that great presentation. I learned a lot and found out that my sorority is not doing so great. And we were one of the ones with a lot of red. So that's not super encouraging. But thank you so much for everything. So we will start off with a group of questions about testing on campus. So JulieAnne, this one will be easy for you. But relating to the travel testing in the vault kits, when you go to get that test, do you have to pre-register for it? Do you have to wait a long time for that to happen? How is that looking like for the individual who wants to go get that done?
Thanks, Brielle. That's a great question. So vault kits you have to register with Vault. So you'll set up an account once you get to the site and fill in a bit of contact tracing information, answer a few questions. We're here to assist with that process. And then you generate your sample. And that sample does require a few milliliters more saliva. So we're finding folks take about 10 or 15 minutes to go to the website, fill out the questions, generate the saliva sample, kind of work through it that first time. And again, it gets better with experience as you do it. You can walk up to any test site between 10 a.m. and 3 p.m. that offers these, and the two sites are Price Gilbert Library and 760 Spring Street. You can walk in and request a travel certification or a vault test. We'll know what you mean, and there will be staff on hand to take you through that process.
Awesome, thank you. And then a follow-up question to that, which came in the chat, is there any discussion of allowing employees to take advantage of this travel testing, even if they're traveling for non-business related things?
Right now, there has not been. These were purchased with state funds, so we're using them for business purposes for employees.
Awesome. Thank you so much. And the next one is, when will the results be available for those who test this coming Monday and Tuesday before Thanksgiving?
So we have an average 48-hour turnaround. So I definitely recommend testing Friday or Saturday if you're concerned, and then maybe again Monday and Tuesday before you leave. As far as exit testing, Joshua's advice about adding an extra cycle, I think, is just really good for peace of mind as you're traveling. And again, that applies to the surveillance testing. Vault, you have to work through the timing with your airline or the destination requiring certification. They have a lot of diversity and restrictions on when they want you to take that test.
Just to add what should be obvious to that, don't get tested, get 2 negatives, and then go to a party before you go home. So once you've been tested negative a couple of times, maybe it's time to leave and go home a little bit early. I know that many of you got plans, but don't be out partying, because that's a very natural inclination to say goodbye to your friends. But, it's all about protecting mom and dad and grandpa and friends at this point.
Definitely. And getting tested multiple times means you get multiple cookies. So always positives for that too. And then we also had a comment come in before and was saying that they really want the Snickerdoodle cookies back at the first center testing location. They like the chocolate chip, but Snickerdoodle is good. So definitely cookies.
I agree.
Okay, so the next question, which I know that I've even personally been getting this question a lot, is if I have previously tested positive for COVID-19, if I keep getting surveillance tests, when can I start getting those surveillance tests done, and what is the science behind that?
Greg, do you want to start on that one? I'll fill in, or how do you want to take that?
Yeah, so currently there's data coming out that we have what are called neutralizing antibodies for up to 6 months. They do decline over time. Now, that doesn't necessarily mean they can't be boosted back up. So the more and more evidence is that there is reasonable protection for at least 3 months, probably 6, maybe longer. So we've not recommended people get another test after they test positive. We haven't actually set the policy on that yet. Joshua may have some thoughts. I would think that if you tested positive back in August, September, you should be getting surveillance tests again starting in January. In fact, we'll have a 2-month break just about. So by mid-January, people should probably be thinking about doing surveillance testing anyway.
That's right. So let me just fill in a little bit there, which is that waning of antibodies does not necessarily mean vulnerability with respect to immunity. So there's something called seroconversion, where someone is infected and then will show up positive on antibody test, which we are not yet offering, and then may show up later negative on antibody test, but that doesn't necessarily mean that they can be infected. So there's strong evidence that reinfection is rare. So if you've tested, and we're starting to see some of that where people go back in and what we classify as repeat positives, people have been infected twice. And at present, when I say, let me clarify, infected once but show up positive more than once. That doesn't mean that they're infectious. And we have been working with STAMPs to make sure that we understand the particular case. And then Dr. Ben Holden has been very good there, that if an individual has no symptoms and they have a repeat positive, current science indicates that it is significantly unlikely and is not correlated to infectiousness. So at present, I would agree with Greg that individuals who tested positive in late August, early September need not continue to test, particularly in the absence of any symptoms, and that they could then restart in the spring. We may do more with respect to serological testing. That is something we're evaluating, but at the moment, I would simply hold off and then return to the program beginning in the spring term.
But I'd add that what we're looking at is hopefully some sort of a visa program where people have either been positive or they test negative, to help them get to research space or maybe even classrooms. It's still being looked at by different communities on campus, but either of those two things. But of course, you don't want your faculty or other people knowing what the status is. So there's HIPAA violations and so forth. So if that can all be centralized with just a report that you're good to go, which is what we're working towards, then that's what we'd rather have. But a lot about this virus is still confounding us and still learning it. But there's been a lot of good news lately. I mean, the good news on the neutralizing antibodies, there's good news that there may also be something called T-cell protection for some people, maybe as many as 20% of people. Of course, we don't know who they are, but that could be there. That will help. And now the vaccine data, if that really is 90% effective and can be delivered to a large number of people next summer, this all really begins to see a way out of it starting, by this time next year.
Right, and a good point there. I don't know if it was raised, and I realize we're diverging, so we want to make sure to have more questions. But just keep in mind that the good news on vaccines is different from large-scale delivery. So at present, despite the very nice news about early results from these vaccine trials, we don't anticipate that will impact the need for testing beginning in January.
Awesome. Thank you so much. That's a great answer. And I just want to make sure that there's a few questions coming in about specific testing sites and times, and all of that information is on the Georgia Tech testing website, and you will be able to remember it a lot better if you just go and look it up yourself than us just ranting off a lot of days and times, but it's all online for you guys. So the next question, as we're moving into the spring semester, we're getting the guidance from USG to have more in-person classes and educational experiences. But from your explanation, it seems that COVID-19 spread is mostly happening due to social gatherings, which is difficult to enforce mask wearing and social distance. But what about classes? Is there science and metrics of how we've seen the spread in classes and how we're preparing for the spring semester?
Well, I took my class back live about a month ago, and about a fifth or a quarter of the class decided to come in. At that time, things were at 0.2% or 0.3%, and I said, it's not going to change for the next year. And I think that's even true after the vaccine, that we're still going to have a low level. So you have to ask yourself, what's the risk benefit? And the classrooms are very, very well fit with cleaning equipment. They're well spaced. People have masks. That's essential. You don't go to a classroom without masks, everybody. Hand washing, the materials are there. So I think they're not perfectly safe environments, but you have to ask yourself, are they as safe as they're going to be? Ideally, we could have more classrooms outside as well if it's warm enough in the spring and if we can get there. So, there's no prescriptions. There's no metrics that we've said when it gets to here, we'll go back into classrooms. I mean, USG obviously wants more of that. Parents want more of that. I think hopefully students want more of that, at least some. But we have to be vigilant and we have to be thoughtful about it. And we all have to have our own comfort space on that. So I'm certainly, I'm happier to go back in, even though I'm older, as it were, getting there at any rate, to a point where I have to worry about it. So I feel like, there's no evidence whatsoever that we've had much spread from classrooms. In fact, certainly it's not been a major source of infections. I'm fairly confident about saying that. But then again, there have been very few people in classes. Joshua may have some thoughts on that number about how many people in a class, are tolerable for given rates.
Yeah, I think the answer here, first of all, it is going to be nuanced, and also it will depend on class size, because if we want to make sure to reduce risk, that will depend partially on the dynamics of the epidemic, right? So if case loads are going down, we have some sense of odds when we take a group, but also we want to sort of space people out, enforce mask wearing. All of that's going to keep risk lower. There may be other ways to have personalized interactions, small groups outdoors that, again, certain kinds of class operations may not be amenable to that, but others may well be. And those are the things that I think we need to be creative thinking about. And certainly the very large classrooms will probably be the hardest to bring back anytime within the next few months, because then spacing is harder. It's not like then you can keep scaling up the size of the room, but smaller classes in terms of numbers in a larger classroom or outdoors, some of that may be possible, but we always have to keep a priority of the public health side. And that will depend, again, on rates of spread. We're cognizant of the importance of social interactions, and we've been strongly advocating, as many others have too, for the increased use of outdoor space. Where again, interactions in my group, when we want to work a little bit outside and talk about science, we'll go outside with a rolling whiteboard. There are other ways. I realize that doesn't scale for everyone, but we have to start thinking creatively, institutionally, and in groups to think about ways to connect while still making sure that we reduce the chance of new transmission.
Awesome. Thank you so much. And kind of related to this, as we are moving into the spring, a lot of people are worried that when we all come back to campus and re-enter, that there'll be a spike just like we saw at the beginning of this semester. So what kinds of things and precautions are being put in place so that it doesn't happen again in the spring?
JulieAnne, do you want to go first and I'll follow up? Go ahead. I interrupt you. Go for it.
No, thank you, Joshua. It's a little hard with the delays. I do want to say reentry testing is a huge planning effort. We are looking at a more gradual start to the move back in on the residential side and Greek. So we're working closely with housing and student life to understand when there will be any programs, when they expect students who have self-identified kind of that they'll be moving back in, and then to have testing sites available, targeted communications, and really ramp up our testing early to catch as many people coming. Anyone that wants to test that we can get to come to a test site will be tested. That will definitely help with reentry. And we deliberately are trying to target as soon as people come to ensure that as soon as they're on campus, they have more time before classes start to test and then make any decisions accordingly based on the results of those tests.
Yeah, I think there are a couple things that we have going for us positively with respect to the return that were different than the fall. First of all, the scale of testing has increased. The capacity to test is now much greater than it was in early August. And this team is now experienced. The campus is accustomed and used to doing this testing, which means that coordinating testing upon entry is going to give us a much higher chance to pull out, to the extent that people return, possibly asymptomatically infected, to identify and isolate those individuals faster. Spring return has less fanfare to some extent than does the fall arrival. That also helps us. Also, the community is aware of the connection between large social gatherings and spread. And we do have to then rely and communicate that the same issues that were there in the fall, maybe here in the spring. I'd like to think that sometimes it's easier to continue to comply when you see a bright light at the end of a tunnel. And the more news that we get about vaccines, I would hope actually encourages people to stay the course vis-a-vis these non-pharmaceutical interventions, thinking that there actually is in the foreseeable future a potential for there to be large-scale vaccination. Again, early news, early times, but I think those are all factors, and critically, this notion of spreading out arrivals, testing upon arrival, and we have the capacity to do so, should help to reduce spikes. And my expectation is if we do those things, we won't see the return or reprise of what happened in late August.
I think we need to remember too that that big spike in August was around rush, right? And parties as people moved back in. And there were certain Greek houses, I showed them in my images, that were up to 50%, and there were only half a dozen of them. Good news is that there's quite a level of immunity in those houses. We don't expect that most of those houses will have high rates, again, even though that's where partying is going on. But if you go to a party there and you were negative, it doesn't mean you're not going to get it there. So, good news is the rates are going to be lower there, but the bad news is that there could still be central repositories for spread because that's where they're seeding the parties. The other thing we worried about is indoors. Okay, since it's colder, people are going to be congregating a lot more indoors and having events. So it's that social distance, the mask wearing, being cautious. Clearly it protects people. And yet clearly there's 20-25% of the community who are willing to take those risks. I guess what we'd ask is that those ones who are going to be partying and doing that, just be aware that there's 70% of the community that doesn't want that contact. So it's just everybody needs to be responsible. And for the most part, I mean, that's why it's worked here. And I hate to say it, but also at UGA, is students are for the most part responsible.
Yeah, can I add in one thing, because I know that's come up a few times, and this is not meant to malign our sister institution in the state. But if you look at the positivity levels within their own more limited, I think it's called dog check testing program, their positivity rates went up to 9% and remained 4 or 5% for multiple weeks onwards, which implies, if you aggregate that, it's impossible to know unless they were to do serological testing. Our expectation is that a significantly higher fraction, unfortunately, of the community was infected, with potential then, let's say, seeding events into the greater Clark County community, which is problematic. So I want to again reiterate that in addition to protecting yourself individually, students here through their actions and through their caution amidst a difficult time are also protecting workers, facilities workers, staff, faculty, their family and friends. So I think there is clearly a difference and I put this out earlier, at the trajectories of incident positivity between what happened when we got to 4.5%, within 2 weeks we were down to less than 1, UGA went up to 9%, was still 4 or 5 and lingering onwards for much longer. We didn't have that outcome, and I think that's partly a direct testament to this early identification. Clustering can make things worse, but it also can allow us to respond. And one other small comment, which is even if folks aren't partying, the reality is asymptomatic spread means that this partly can be by chance, that an individual goes out, has been doing all the right things. There's many examples of someone who I was wearing a mask. I have no idea how I got infected. But then the reality of Greek living is it's close quarters, often shared spaces, and all of that is household-like, and household-like transition is real. So I just want to make sure that people get that. We continue to see, whether it's in doubles or quads, and also part of the Greek housing story is really a household-like transmission story. And that, that's not ascribing any blame. That is just simply the reality of dense live, learn environment.
Yeah, and we're tag teaming, but Joshua made the point that we protected staff and faculty I mean, I think that's one of the things we're most proud of, is that the rates in the staff have been very low. I'm not aware of any faculty that have been hospitalized, or in fact, we don't know that data, but certainly I think we would have. And that's amazing, because that was our biggest fear at the start of the semester, is that we could have deaths and hospitalizations without a program, and it really hasn't happened. And that's part of the responsibility. It's not just to your colleagues and your peers, but it's to the entire community, and it's worked.
Thank you so much. And Dr. Weitz, I want to thank you for bringing up the point of not shaming anyone for testing positive, because I know that's been something that the Georgia Tech community has been, going through this semester. So I thank you for that. And you also mentioned vaccines, which set me up perfectly to ask the next question of how is Georgia Tech going to respond to the time when a vaccine does come out? Is asymptomatic testing going to continue? Will students and faculty be required to have the vaccine to be on campus?
I think the right way to answer that, if you can hear me, it's a great question, but keep in mind the context that there are many examples of which you already have to have your vaccination schedule in order to arrive. The requirements of a yet non-existent mass delivery effective vaccine makes this hypothetical a little bit tricky to answer. And I think those kind of questions will really end up becoming State Department of Public Health questions that will be distributed, and I expect will be uniform through the system. So I recognize that our testing program may be different, and we've spun this up locally here at Georgia Tech, but a vaccination program and policy is certainly one that I anticipate would be common to all members of the Board of Regents USG institutions. And so that will just simply depend upon timescale and availability and effectiveness. I hope that we would have a large-scale effective vaccine that can be mass delivered by summer 2021. That would be very good news, and there's been some good news recently. But I think it's too early to speculate on how that let's say the delivery or requirements might unfold.
Thank you so much. I know that that'll be a question that will, keep being brought up until we have the answer to it and there's a vaccine. But thank you so much for that answer. We have a few kind of random smaller questions as we're wrapping up here in the last few minutes. But one of them is talking about how frequent hand washing is not mentioned as frequently as an important preventative measure. And based on what we currently know about the virus and its transmission, is that step no longer as important as masks or distancing?
Can we say both? Also important. One of the things to keep in mind, this is a respiratory disease, so I think it's been increasingly evident that indoor spaces particularly can lead to larger scale transmission events. But I was given an example of someone who's going from one place to the next. What are the risks that person, if they were in place one and someone might be infected, they could bring it to the second location? Then it becomes an environmental transmission, because if someone were to be infected, there's going to be an incubation period before they can infect someone else via the respiratory route, but they haven't washed their hands. There could be an environmental transmission route. So I would just simply say both, that hand washing and good, that sort of good approach to public health, good old-fashioned public health is one part. The other part, though, because of the respiratory nature, mask wearing is obviously a critical part, particularly in indoor locations, when one is sharing an indoor space for an extended period of time.
Thank you. And one last question here before we wrap up and have final words. But this one is for you, JulieAnne. Has Georgia Tech considered offering the surveillance testing in the spring for spouses and dependent children of faculty, staff, and students?
That is a great question. I think we have a lot to discuss and a lot to understand as we ramp up our testing. There are also questions about use of the protocol for pediatrics. So in talking with Dr. Holton at Stamps Health, the recommendation for children is to consult a pediatrician. So a lot of questions. It's very nuanced, and I'm sure as decisions are made and conversations happen in the spring that any updates will definitely be shared out with the community. For now, it's been a great help to have the Fulton County testing site at McCamish Pavilion. And that is a great place for personal travel or for family members of those who live near campus around Fulton County to test. And they are still open until Tuesday the 24th, right before Thanksgiving. So I do want to just give a shout out to that as an option.
Awesome, thank you. And to a testament of how amazing our testing is on Georgia Tech's campus, I keep getting a lot of comments from recent alumni saying that they're so jealous of Georgia Tech students who get to test here, and they're very sad that they can't be a part of it. So just want to thank you all for your hard work and answering these questions and giving some insight as we're wrapping up the semester here. And I'll pass it back to you, Dr. Steelman.
Brielle, thanks.
Those alumni should just come back and do a second degree, and they can get tested all the
time. we have a couple of minutes to wrap up. So Joshua, Greg, and JulieAnne, please give us a wrap up, and then Brielle, I'll give you the last word.
I guess just to jump in, thank you, Joshua. Just a long pause, so I'll jump in to Phil. I want to thank everybody in the community. We have a very responsible community in terms of behaviors, and we have an amazing group of faculty, staff, and students who are dedicated to making this surveillance testing work. I get the pleasure of sitting here, but there are so many people that, from our student ambassadors through our facilities drivers to the scientists that thought up how to make this work, to the folks in the lab, student, staff, and faculty, HR and procurement. There's just been a lot of folks, and I want to thank you all. It makes me really proud to be part of the tech community, and just go Jackets.
Yeah, I just absolutely reinforce that. This is just an ongoing thing. We're learning every few weeks. I mean, we didn't expect this second jump, and then we didn't expect we'd probably get on top of it as quickly as we have. But it's all a balance, and we've seen this program all along as a way to sort of bridge between health and economic and educational activity. It's not either or. What we think is this program buys us the capacity to do some of those things we love to do. And so if we can keep it low in January and February, we can start being more of a community. And that's everybody's responsibility to respect that we all have different approaches to this. But if we keep up the sort of behavior that we've seen all semester long, then we've got a really good shot.
And I would only add that one of the features here has been an emphasis and an effort to be transparent, both when things were good and when things were bad. And what I mean by that is, from the outset, even when we started with low levels back in August when we had one of our first ones, I think Greg was the one who cautioned, let's be careful. It may be that there are going to be increases to come, which happened. And I think one of the key points and approaches we will continue to do moving forward is to communicate transparently and also in a data-driven fashion to make sure that a well-informed community can remain a safer community. And that takes a partnership, and we'll continue to do that into the spring term. And again, in the spirit of that, we will be releasing slides. I know someone asked that question. Like in prior talks, all of the slides and information will be available for anyone to look at afterwards or to share with friends and colleagues in the community. Thank you.
And JulieAnne,
one more thing, Joshua, is that, both you and I have had the message that says you've been recommended for further testing. And it's painful, and we get that it's tough on students. In both of our cases, we were negative. So we know that happens as well. But it's not an easy thing, and we get that, and we fully appreciate that is some mental toll on that as well, so which just makes it even more and more amazing that people are participating at these high rates.
And JulieAnne, you took the words out of my mouth. I'm so proud to be a Yellow Jacket this semester. I'm graduating here in May, and it is the weirdest last year of college I could never have dreamed of, but I have never been more proud to be a Yellow Jacket. And to all the students still listening, good job. I'm proud of you. Keep going. You are doing such a great job and helping this be a successful semester. And I just want to say a special thank you to the four of you on this call. You have been so impactful in so many lives in the Georgia Tech community this semester. And so I just want to thank you, and we really, really appreciate it.
Okay, thanks to you guys for the presentation. Thanks, Brielle, for the Q&A. It was great. And thanks to everyone who listened in today. So this will close today's town hall. Thank you.